Welcome back to Financial Independence 101. This is Mike. Today I want to talk to you about universal health care for all and why we really do need this in America. I'm going to talk about this. We do have the Obamacare, aka Marketplace. And the thing about that is that is for low-income people. We will discuss that, but that's a framework for building on. We can reform that to be universal health care for everybody. But then a lot of people are going to say, but Mike, aren't you like a far right conservative? Yeah, I'm as far right as it go, more conservative. But the farther right you get, the more you care about people. And that's all there is to it. People that work hard, people stand on their own 2 feet. And this is something that we need in America. And I'm going to tell you, it's not something we need just for low-income people. It is for everybody. It should be an option for everybody. And we've actually seen this up there in Canada, Actually, every Canadian that I know and I have talked to or heard talk about the healthcare in Canada, they love this because it is, to a point, optional, but the basic minimums of healthcare are provided for free for all citizens in Canada. And I got to say that we could emulate that here. I don't want to emulate everything Canada does, trust me. But with this, I might want to do it. Let's talk about this, and we'll do some comparisons to what's going on with Obamacare and what we should see in America, what we should all fight for coming up. So the first thing you're going to say is, Mike, how are you going to pay for it? And I've been an advocate for shrinking government for a long time, and I would love to see a reduction in spending in the government. But when you also look at this, Medicare and Medicaid spending is very high, and we would probably double that to give it to everybody, the option to everybody. Now, this isn't forcing it on everyone, it's an option to everybody out there. Would easily double that. There's a lot of non-defense discretionary that is literally just wasted money. And if you could let me see every dollar they're spending, I'll get a red pen out and I'll show you. I mean, they don't disclose all of their expenditures because it's in the interest of national security, I'm sure. But with that, cut this and wait, hold on. Let's stop sending money overseas in the form of aid to other countries immediately, right now, and start sending aid to American citizens in the form of universal health care. One of the problems that we're seeing right now is that we have gig workers in the gig economy, and they don't work a traditional type of job. A lot of the people drive an Uber, do the Uber Eats, and all that. And I just go to that because it's quick and easy to go to. But there's so many other things that people are doing. Yeah, YouTube channels and being influencers, OnlyFans pages. I mean, there's a lot of things that people are doing, and they're not paying into the system. So it is actually getting harder and harder to pay Social Security and Medicare because it's not getting paid into the system. We might as well revamp it all anyway. It's going to need to be revamped or reformed eventually. So why not do it now? And why not make it to where it's a feasible, plausible system for everybody? So currently what's going on right now is under the Affordable Care Act, you may qualify for premium subsidies and discounts that reduce your monthly cost of a health insurance plan. They are paying another health insurance company to give you coverage if you're low income. And I'll show the income ranges here in just a bit. I have a chart. Subsidies are tax credits based on your estimated income, and there are income limits that qualify for financial help and to pay your premium. But it's different than what Canada does. So I will show what Canada does in a little bit. Canada does give it like a baseline. Everybody's got this base minimum expectation for basic healthcare. Basic. If you need to see the doctor, you need to go for basics. Now, if you need other more fancy things, fancy treatment, then you might have to get another type of insurance. But for the basics, the necessities, what's necessary, then it's covered. Changes to your income can also alter your plan. Now, let's get into looking at this real quick. Now, I've got this chart here. This is the Federal Poverty Guidelines snapshot, and used to be for the 2024 coverage. So they're taking the 2023 federal poverty for the 2024 coverage year. And looking at this, if you're one person by yourself, poverty level is 14,580, and then 138% of poverty level is 120, and then 400 is the 58,320. Now, let me say I'm a family of four, so I looked into it on a family of four just to find out numbers. I wanted to know numbers. This was a couple years back, and they said about once you hit about 50 something thousand, that's when you see the point of diminishing returns for a family of four, meaning that at 50 to 54,000 for two adult income earners and two children, that you get the maximum benefit, which is like $500 or $600 that they pay towards your monthly premium for one person, and up to that for 4 people, if you insure all 4 people. Now, here's the thing about that. If you look at this, once you get to about 75,000, even though this chart doesn't show, once you get to about 75,000, it's pretty much gone. It's gone. This is what you call a glass ceiling. I'm going to talk about other things in the future that are glass ceilings, financial glass ceilings in America, but it's a glass ceiling. So if somebody is making 55,000, a couple with 2 kids is making 55,000 together, if they are to work an additional 15 hours at $16 an hour and make 75,000 together, they would not only lose their coverage for the most part, they would also get taxed, and it'd almost be worthless for them to put in an additional 15 hours a week. They'd have the same exact lifestyle because of health insurance they'd have to pay for on their own, which does kind of suck, but that's the way the system is now. That's why it should be universal health care for everyone. So what about our good friends in Canada? It's kind of like one of those things that in Canada, healthcare is great. It's wonderful. Well, there's some drawbacks, but let's look at this really quick. I do want to kind of cover a few things when it comes to Canadian healthcare. Now, I don't live in Canada. Canadians will be able to school me on this a little bit better, and I'm fine with that. I would actually love that if you live in Canada and you know more about this than I do. But Canada has a decentralized, universal, publicly funded healthcare system called Canadian Medicare. Healthcare is funded and administered primarily by the country's 13 provinces and territories. Each has its own insurance plan, and each receives cash assistance from the federal government on a per capita basis, meaning the more citizens you have, the more money you get. Benefits and delivery approaches vary. All citizens and permanent residents, however, receive medically necessary hospital and physician services free at point of use. To pay for excluded services, including outpatient prescription drugs and dental care, provinces and territories provide some coverage for targeted groups. In addition, about 2/3 of Canadians still have private insurance on top of or in addition to. You might be wondering why you're going so deep on the Canadian, because this is the best example out there for what universal healthcare could be in America. So looking at this, what I get from this, and there's a whole lot of stuff going on here, but I'm going to focus to the lower left of this, where you see down there where it has Canadian Institute of Health Research, patented Medicare Price Review Board. So that Price Review Board right there is where they do control some of the prices. There's some price controls in there, and I'm not a big fan of price controls, but the thing is in order for this to work, there has to be some level of price control. And therein starts to show some of the issues involved in this, which some physicians may not make as much money in Canada as they would in the US, with kind of just a free-for-all for whatever you want to charge for your prices. But in Canada, they're only going to pay you this much for this service, and that's it. And that's what this board's about. And you have to figure out how to make a profit as a physician charging those prices, because that's all you're going to get paid. And you have to see those people. Now, in the US, we do have some doctors that will not take Medicare. You have to go to certain doctors, and that's understandable. But with that, that's why there's still a market for private insurance. So there'll still be a market in the US for private insurance. Now, how expensive is it? Well, it is quite expensive. It's 11% of their GDP, and that's a lot. But really, it's not that much, the truth. The public sector and private sector accounted for approximately 70% and 30% of total health care expenditures. And with that, it's financially feasible to be done in America. They can do it there. But the drawback is higher taxes. I want to get back to this paycheck stub. It's just like a fake, generic paycheck stub. But if they reformed it, they would eliminate the whole Medicare and Social Security, and it would literally just be one tax. And I'm going to get into my next video talking about flat tax, what it takes to run the government, flat tax. And with that, they just put it all into the federal income tax, because Social Security is not a savings account. It's all spent. It's all gone. It's a here and now situation. And with less people paying into it, and same thing with Medicare, less people paying into this, then there's just nothing there. So they're having to print the money anyway, create out of thin air to continue the system. A lot of people feel like there's not going to be anything left for Social Security or Medicare for my generation. Gen Xers are just going to be left out. But there's always going to be a payout because they're always going to do whatever they got to do, print the money out of thin air, create it, sell debt, and all that kind of stuff to pay it out. But it's not going to be enough to live on for Social Security wise. Social Security is a different topic here. But when it comes to the Medicare, I mean, the system's broken, but universal health care for all could be a solution if it was reformed properly. Now, taxes going up, I mean, and we're not talking just a little bit significantly increased to cover the cost, is one of the bigger issues. Now, every Canadian I talk to does say they feel like they're heavily taxed, way overtaxed. But I feel like we're overtaxed in America too. But living in Canada, I bet you, yeah, y'all are probably paying way more taxes than we are here as a whole. Now, the other biggest problem is that you're going to see longer waits for emergency rooms or standard doctor visits and those kinds of things, because I can tell you right now that I know a lot of people that are constantly having a quote-unquote emergency that I do not declare an emergency. I do not believe it's an emergency. And obviously, if you're in pain, I mean, pain is a sign of a problem. But there are hypochondriacs and there are people that just want to go to emergency room for maybe getting pills or something along those lines. And a lot of this will congest emergency rooms and these other places, these outpatient treatment centers. And you also have the urgent care visits. All of this will start to congest. And you could start to say, well, I want to make an appointment for something. For my appointment would take a week out now, but under universal health care could possibly be 2 months out. So there's a lot of situations and issues that arise. Obviously, you would want emergency room visits to still be very timely, but if it's filled up with 3 times the number of people, it's going to slow it down. Now, that is what I've heard as an issue in Canada, but I think it was an issue early on, and nowadays they have found ways around that. I believe the best way around that is a copay for every emergency room visit, and people won't be going every day just for fun. And I got to tell you, it feels like that. It feels like there are people that I know that go to the emergency room very frequently. I've been to the emergency room twice my whole life, and I don't ever want to go back unless I have to. But with that, universal health care would open up that issue again. So I'd like to know where everybody stands on universal healthcare for all. Is this something that you'd like to see? Are you tired of seeing the money taken out of your check to pay for insurance that you almost never use? Would you rather have the whole country go to a universal healthcare for all? And yes, we pay a little more in taxes as a whole, but we'll be talking about how to revise the tax code in the next video, and that's going to be fun because the flat tax is the only fair tax. Let me know what you think in the comments below. Like, subscribe, and financial independence out.